Good morning, everyone. Thank you for joining us today for this webinar. We are going to hand things over very quickly to Heather Stauffer for her to make a quick introduction of all of our presenters today.
Okay, hi everyone. I'm Heather Stauffer, Legislative and Policy Advocate for CML. Thank you for attending today's webinar. For those of you who are joining us from CML, this webinar is being recorded and will be posted to the CML website at www.cml.org/COVID-19. If you aren't familiar with the webinar format, you should see a control panel at the top right hand of the screen. You have an orange arrow to the left of the panel, which will minimize the entire box. All participants will be muted for the webinar, but are encouraged to ask questions by typing them into the question box on the control panel. We will hold a Q&A near the end of the webinar, but please feel free to type those questions as you think of them throughout the presentation. So I want to thank our panel of experts today, who are all here from McKinstry. Jim Hosworth, who is a Senior Building Energy Analyst, Devin Boyce, who is a Facility Program Manager, and ASHRAE Brassavan, who is an Account Executive. They're going to talk to us today about how to wake up our municipal facilities after being unoccupied or partially occupied during COVID. So I'll go ahead and turn it over to Ashley.
Great, thanks Heather and Courtney. Can everyone hear me okay?
Yes, we can.
Great. Well, thanks for CML for allowing us to present today. I know they're a great partner. They're a great resource for everything related to municipalities throughout Colorado. I'm ASHRAE Brassavan. I'm an account executive at McKinstry, focusing on local government. So I've worked with local governments in Colorado for about 5 years. And we really want this to be an interactive session. I know all of you are on mute today, but if you have questions throughout the presentation, or if there's anything you want us to specifically hit on around opening your municipal facilities over the next couple of weeks as everyone starts to get buildings back online or up to full occupancy, just feel free to type them in the chat function and we'll try to field those questions and orient some of our content around your specific concerns throughout this presentation. So with that, we'll go to next slide. So again, I'm ASHRAE Brassavan. I'll let Jim and Devin introduce themselves and share a little bit more about their backgrounds.
Sure, real quick. I'm Jim Hosworth. I'm an energy analyst with McKinstry. I spend most of my time doing commissioning work, retro commissioning work. Work with a couple of cities here in the Front Range. I also work with a couple of universities. I spend most of my time going to maintenance offices and sitting with those folks and working on low and no cost ways to improve energy performance. And I'm gonna mostly talk about the HVAC systems and kind of what the recommendations of the moment are for how you should be handling that. Devin?
Thanks, Jim. My name is Devin Boyce. I'm Program Manager with McKinstry for Facility Condition Assessments. My primary function right now is to support the condition assessments relative to capital planning efforts. That can be for municipal clients. Certainly that's very common for us, but also higher ed, things that anybody that owns their buildings, that's where we want to get involved. Generally, we're looking at deficiencies as well, being able to classify and come up with strategies for addressing or remediating any of those deficiencies.
Great, thanks Devin and Jim.
Thanks. Back to you, Ashley.
So I think we just want to start out with, what are we hearing from employees throughout the US? There's been a lot of research, a lot of polls that have come out. And again, feel free to type in if you have employees that have specific concerns that you don't really have a solution yet, and that's something you want to throw out there for us to address throughout the presentation. But I thought this research the past couple of weeks was really interesting as they polled employees about what are their biggest concerns and what's most important to them to make them feel comfortable returning to the workplace. I think municipalities tend to be some of those who didn't necessarily work from home regularly prior to COVID-19. And throughout the US, only 11% of employees really pre-COVID worked from home regularly, and about 30% had even had that option. And so as we're looking to transitioning back to a new normal, a lot of employees really want stricter policies against coming in sick. I know personally, before all of this happened, and I was probably guilty of this too, coming into the office when I was feeling a little bit under the weather, but I think putting in a sick policy or implementing that coming back in is something that will make employees feel comfortable returning to the workplace. I think just in general, increasing the opportunities to work from home and work remote versus doing business travel or going into the office. I think Devin will talk a little bit about reoccupancy guidelines and what they're recommending in terms of percent occupancy as you're returning some of your municipal facilities to full occupancy, and then just increasing the cleanliness of the office. So I think those are really the top three, but all of these are really great tactics for making employees feel comfortable returning to municipal facilities that we'll talk a little bit more in detail about throughout the presentation. And this was just a little bit more research. So increased social distancing and a reduction in shared workspaces are viewed positively by employees as well. So when we're looking at what would continue to make employees feel comfortable as they return to the workplace and return to municipal facilities, so just increasing social distancing guidelines, whether that's floor markings or reorienting workspaces. Again, just increasing the ability to work from home. A lot of employees said that going in part-time or going in at a reduced amount versus pre-COVID would make them feel more comfortable returning to the workplace at a reduced level, and then reducing just the number of shared workspaces in general were the top three things that employees were saying that they wanted. So I'd be curious, and again, feel free to enter in the chat function if you've surveyed your employees and what you're hearing from them, and we can maybe address some of the tactics to get some of those deployed throughout your municipal facilities. But if you haven't done a survey, I know that's pretty common that office spaces that are reopening now are looking at utilizing surveys and sending those out to employees and just hearing from them about what they want as they go to reoccupy buildings and go back to the office. What are your employees looking for? And that's the best way to figure out a reoccupancy plan, is just figure out what your employees in your office really wants out of that plan and how to move forward into reoccupying your facilities. So with that, I'll turn it over to Jim to talk a little bit more about specifics.
Okay, I'm going to talk to you guys for a little bit. So again, I would love it if someone had a question and you text it and it makes it to ASHRAE, and we can expand on some of these things. I'm going to try and move quickly through these first couple things, but most of you guys have probably already done this, but and this is a little bit tricky in that there's also a budget crunch coming with this. I spend most of my time doing energy work, right? I'm a mechanical engineer and I work a lot on control systems, motors, pumps, valves, and we need to consider basically shutting off the buildings that you're not using. There's a lot of savings to be had. I would just throw out somewhere in that realm of 40 to 60% reduction is what I've seen in the two big cities that I work with in terms of their total utility bills for March, April, May, and probably even June. But I know we're talking about keeping people apart and social distancing, but if you have 3 municipal buildings, really thinking about, is there any way to cut that down to 1 to keep one building completely mothballed? There's a lot of good savings in that. I won't beat that one to death because I know we're here to talk about reopening buildings, but you want to switch to the next slide, Ashley? So I think at this point, we're really at a point where I'm guessing you guys are thinking about, okay, we're about to reopen these buildings. What do we need to do? Typically, if you haven't done so already, I'm sure, there's a picture of a fire station there. Those fire stations are already open. At least getting your maintenance staff ready, or if you hire out to a mechanical contractor, you need to be thinking at least 2 weeks ahead. Getting all the preventative maintenance work done that they can. That includes going in, changing filters, greasing bearings. We're going to talk a lot about filters here in a second. There's a lot going on there, but I think I have this in almost every one of these slides, but checking your outside air dampers. The biggest thing you can do for this is check to make sure that outside air dampers are opening properly. And I'll keep hammering on that. And then, making sure that someone has actually put eyes on those things before you go in and open those. But timeline wise, yeah, you need to be thinking a couple weeks ahead of when these facilities are opening. Next slide, Ashley. We do a lot of data analytics and diagnostics with our facilities. Again, you should be one, looking at the utility bills. You should be seeing a pretty major reduction in your overall utilities. And mainly those are water and gas. You can and possibly should see some reduction in water consumption. A lot of that is going to irrigation during the summer. There's a possibility of letting the grass get a little brown over the summer. If you don't know how to log into your building automation system, maybe you let a contractor do that. You should have someone going in there and looking regularly, looking for anomalies. Is equipment running too much? Are the outside air dampers opening? Health-wise, that's probably the biggest thing you can do. Monitoring filters, that's a big part of this. I mean, maybe you just went on a regular 6-month preventative maintenance program where you changed filters regularly, but you need someone going in there and looking at those filters. Are they loaded, especially if you're going to upsize to a higher rated filter, which I'm going to touch on in one of these next slides. But basically, you want to be able to use your DDC system to go in there and check on the mechanical equipment. Walking around the buildings before they start, looking for building leaks. Use your nose, smell, observe. That's probably how we find a lot of the best things that I get in the field. Next slide.
And Jim, we got a question. So is there a certain percentage that the outside damper should be open? Or maybe could you just talk a little bit more about outside airflow and what percentage you should be getting in your buildings at different times, unoccupied versus occupied?
That's a great question. That is the question of the moment. Well, there's two of them. I mean, typically, in a typical building, there's obviously tons of exceptions that go with this. I'm going to throw out the number 30%. Generally, as a rule of thumb, 30% is even on the high side. But, typical office building, typical occupancy, if you run, let's say you have 1,000 CFM, 300 of those CFM should be outside air coming in continuously. Now, that said, you're going to be reducing the occupancy in the building, hopefully, so you're actually getting quite a bit more fresh air per person, which is how that's generally calculated. So outside air is not a major concern, and I don't really have anything touching on this, but I think it's really important to talk about. I spend my days as a mechanical engineer, really a commissioning engineer, and I'm not a public health expert, but I've gone through and read a bunch of the white papers and the literature that I could find. And it appears that the science appears to indicate that the likelihood of COVID-19 being airborne through an HVAC system is extremely low. I was telling these guys earlier, there's some probability distribution where it could happen. It is possible. But that should not be your primary concern. That doesn't mean you shouldn't take the right steps and check the outside air damper and get the right fraction of outside air, but it appears very, very unlikely that this is going to be a primary mode, path for the virus to take to spread to people. And I use the example of, I could only find one example in literature. It was from a restaurant in China where there had been an outbreak, and it didn't even have a proper HVAC system. It had ceiling fans. And that was like the only example that people could come up with where they could say definitively it actually had spread through, you know, airborne viruses. And even at that, I don't even know how much of that I believe. So take 30%, and then I'm going to talk a whole lot about air fractions on the next slide. So let's jump to the next one. So for those of you guys who aren't familiar with ASHRAE, the American Society of Heating, Refrigeration, and Air Conditioning Engineers, they're sort of the governing body for best practice in HVAC systems. And they have written a position paper on infectious aerosols, obviously directly related to COVID-19. So I'm going to just touch on what their specific recommendations are, because they are sort of, I don't know, the governing body. And that, you know, this is not a code or a standard or anything like that. This is an opinion. One thing they do say, and I will say this stuff is changing rapidly. I mean, even just a couple of weeks ago, we did a similar presentation for rec centers, and I was not thinking about changing filters. They've sort of, they've suggested that you upgrade your filters to a MERV 13 filter, which you probably can do with pretty low consequence. And they bucketed their recommendations in terms of evidence level A and evidence level B. So the stuff that I have highlighted here is the evidence level A. So higher level of filters, that's maybe the one physical change that you could make in the HVAC systems that would be, I think, an appropriate thing to do. UV filtration can work, but again, this is high density spaces, waiting rooms, prisons, shelters. So unless you're running like a homeless shelter or a prison, or you have some kind of hospital waiting room, I don't think that applies to any of you. Local exhaust ventilation source control. So basically that means the bathroom fans should be running. You know, if you have other exhausts in places where people are sitting, that should be operational too. I think part of this slide got cut off, but you know, the evidence level B basically suggests that freestanding filters, don't worry about it. I forget what's the second bullet on there, Ashley. I can't actually see that. There was, but basically my recommendation, and the one that I read in the white paper, is anything that plugs in, don't worry about it. You're really not going to get any benefit from it, unless it makes people feel better, in which case feel free to go do it. But realistically, the only thing that I can see that you wouldn't normally be doing, again, you need to check your outside air damper, get the right fraction of outside air in there, but you can upgrade to a MERV 13 filter. Beyond a MERV 13, you're talking about hospital grade filtration. So I can't remember what that's.
Last bullet, Jim, is temperature and humidity control. So maybe just touch on.
Yeah, great point. There's a lot of research out there. And I say research, I mean, I guess some of it's anecdotal evidence. But, you know, should you be trying to, you know, does this virus behave differently at 76 degrees versus 72 degrees, or 60% relative humidity versus 30%? Short answer is, don't worry about it. Control your building to where people are comfortable. I couldn't find anything that said you're better off controlling to one temperature or another. So no real change with temperature and humidity. Next slide. So I think with a lot of this on the HVAC side, I mean, Devin's going to talk a little bit about the physical building side, but what do you need to be doing? What should you be telling your building people? But basic maintenance, this is stuff you should be doing anyway, but hopefully you're now paying extra close attention to it. Getting it done before your building's open. Go back to where the facility was previously set. Hopefully you shut things down. I said set the schedules carefully. This is a great opportunity to think about how you're scheduling the buildings and when people are using them. So one of the biggest energy savings measure I find out there, period, and I would be happy if this got eliminated from my life, is just that there are pieces of HVAC equipment that operate 24/7, or, you know, the building only gets used 6 to 5, but it operates from 4 a.m. to 11 p.m. So anything you can do to really get the schedule set appropriately is going to save you energy. Now, I'm going to caveat what I just said in that ASHRAE is recommending a longer run time, basically to help flush the building. In some cases, they recommend 24 hours. Personally, I disagree with that. I think it's a terrible idea just because it's going to drive up your energy consumption, which is, you know, I can't think of a single city that has extra cash on hand to spend another, you know, $10,000, $20,000, $30,000 a month on running HVAC equipment 24 hours. So consider that very carefully and schedule carefully. Again, set temperatures normally. Phase startup of equipment, right? The thing I'm trying to hit at there is just don't go hit the on switch for everything all at once. You can really run up your demand. You pay a lot of demand charges to whoever your utility may be. So consider trying to keep that to a minimum and just starting building section by section. We talked about that, but consolidating buildings, if that's a possibility for you. If you have 2 or 3 municipal buildings, you know, you're using a fraction of people are content working at home. Can you keep 1 or 2 of those buildings mothballed? I think that's, you know, it's going to save you money. It's going to lower your maintenance demands. It'll lower your cleaning demands, especially if you're doing really intensive cleaning. There may be some cost savings in that. Domestic water, I think that I would be remiss not to mention this, that there is some concern with domestic water that it's been sitting for 3 months, depending on how these facilities have been used. But before you get people back in there washing their hands, you definitely need to, and this is simple, right? This isn't a complex thing, but probably go turn on every tap and let the water run for, you know, half an hour to do a flush of the system. You need to verify the temperature. Legionella is a legitimate concern, so you need to be storing your domestic water at 140 degrees, delivering water between 95 and 110 degrees. And the testing method for this is easy as can be. You go to the furthest tap out there and someone needs to actually measure the temperature, not just a guess, but those need to be verified. And then I think, like I said, I put it on every slide, testing your outside air damper. And I think on another webinar, we got the question of how do you do that, right? That can be your controls contractor, your mechanical contractor, or if you have to, this is really a good case to hire a test, adjust, balance contractor. If you've never heard of that, you know, we can tell you more about how to hire someone or help you hire someone to do that, because I think that's really critical at this moment. Next one, Ashley. How are we doing on time? Yeah, so extra credit, these things are not necessary. If you need to do things to make people feel better, to tell them that, hey, we're doing something proactive. We've worked on some things in our HVAC system. We're providing more outside air. We're doing a short flush, you know, before the building's open for an hour, 2 hours. MERV 13 filters, you can do that. I estimated a 30% cost increase for those. You probably just need to do it till this thing is done. But if you're running MERV 13 filters, know that you're going to need to change them more frequently, right? They're pulling more, you know, dust and debris out of the air. So again, I said don't plug anything in that promises to kill COVID-19 or anything else in the air. It's probably not doing anything for you. There's very little evidence on this. All the physical barriers that, you know, Ashley was talking about, that Devin's going to talk about, that stuff is way more effective than anything you could do here. I don't think this is going to apply to any of you, but I'll try and mention it real quickly. You know, ASHRAE suggests disabling demand control ventilation. Basically, the point of that being that typically that's a CO2 control that's going to go off at 1,000 ppm. You could adjust that, or you could just disable it so it's providing full outside air. They said, you know, run your systems longer, which I mentioned. They did say 24/7. I disagree with 24/7. I think that's too much. You know, you're getting multiple building air changes if you just start your system a little bit early. And that's why I put that in bold. You know, if people collect this presentation and that gets disseminated with my name, I wouldn't be super happy with it. So use extreme caution there. And then I guess I have to say this, that, you know, if you have someone calling you saying, what are you guys doing? You know, there's tons of literature out there. A lot of it's not overly technical. It's mostly accessible on the HVAC side. You gotta read the literature and be able to cite it. You know, if you've got someone breathing down your neck in terms of, hey, what are you guys doing on the HVAC system, or I don't feel comfortable with it. So don't take my word for it. We've got a ton of links at the bottom, so you can access a lot of that stuff and cite it for anyone that has questions. Next one. Yeah, and I think this may not apply, but if you have giant buildings with multiple HVAC systems, if you're not occupying part of the building, you don't need to turn it on. You know, you're going to have fewer people in the building. That means more ventilation per person. That's a good thing. Don't worry about it. Don't make changes to the ventilation system unless you feel that it's not operating properly. And then I think all of us are going to hit on this, just communicate what actions you've taken to people, right? If you put in MERV 13 filters, you should tell people that. If you adjusted the outside air fraction, let people know. So with that, I think I'm going to turn it over to Devin here.
It looks like
All
I
right.
just got a note that someone has their hand raised. So I'm not sure if there's another question. That you can hold
Yeah,
up.
so this is Courtney, I'm gonna jump in really fast. It looks like
Sure.
Doug Glassbell, and please forgive me if I'm saying your name incorrectly, but it looks like Doug has a question. So I'm gonna unmute you, Doug. And you may have to also unmute yourself on your side, but you should be able to ask your question. Doug? Okay, so it doesn't appear like we're gonna get him. Doug, if you, oh, wait, here we go. Doug?
Or Doug, if you just want to type your question in the chat function too, we can have Heather or Courtney read that out loud. and get
Yeah, we
that
should have
answered.
some discussion time here at the end too.
All right, sorry to interrupt you guys.
No, thank you. No, I think that's good. Go ahead, Devin.
Okay, thanks. So I want to talk through some of the physical building changes. At a high level, there are, it's really about the philosophy. What is it that you're trying to convey? The approach that you're going to take, all these things that we're talking about, every building is slightly different. The function of every building is going to be slightly different. So it's really about identifying what is appropriate for that specific building and that specific function. Admin and office space, the expectation is you use some similar practices, but it's not going to necessarily be the same as what you may do or tweaks that you may make in a police station or a rec center. So understanding that admin and office space is going to be different than maybe public safety and those facing spaces or public facing spaces. There are some things that you can change. So as I'm talking through some of these things as well, understand that it's about changing behaviors. Everything that we're talking about here, especially with the communication, is about building up confidence to know that you can confidently move back into those spaces following these steps and be able to resume normalcy, right? We're moving back to in that direction to try and have that sense of we're delivering the same thing we were delivering before. We've just tweaked things slightly. But then recognizing there are some things that you can't change. So when we're talking about physical building changes, this isn't building new buildings, right? We're not swapping out brand new equipment or things like that. Some small things certainly where you can do filters and small changes, some maintenance items, that's helpful. So then looking specifically, again, talking about the fire and police stations, certainly we recognize that there have been other outbreaks, I guess, tied to those spaces. They have been continuously occupied. They're always operating. So there's not really the opportunity or the same opportunity to reduce the number of staff in those locations. So in that case, being able to identify individual behaviors, taking a behavior-based approach to those folks, identifying checklists, we'll talk about those again here in a second, and really implementing the regular cleaning intervals, basically every other hour, taking that time to do the deep clean and wipe down all of the common surfaces that are frequently touched. Let's see, I think City Hall, now we're getting into some of the public facing areas where there are services and you're interacting with the public. There are areas where you can make some small adjustments. Certainly you can start to install some barriers and install some signage, but you don't want to impede your ability to conduct all that business. So it's about being able to adapt the space, taking into account small changes. Rec centers, as we start to reopen those spaces, and the guidelines say you can start to gather more and more people. The focus is, again, you can't necessarily just close half of the rec center down. It may be more advantageous to have the entire thing open, but then just maintain regular cleaning intervals. And I'll talk through those a little bit more. For the airport and transit, now you're talking about areas that are going to be very much open to the public. There's not going to necessarily be a staff there. So understanding what you can do in terms of limiting folks, in terms of maintaining a cleanliness there, it may be about additional steps for hygiene. In some cases, if you can consolidate those areas, limit the scope of where those services are being provided, limited number of stops, or that sort of thing. But then there's always the back side of the business, right? This is the maintenance shops, mentioned road and bridge shops. These are areas that are going to be very wide open anyway. And so the staff that's going to be located there, their focus will be slightly different. They may not necessarily interact as much with the public, but they're definitely spending time in the public sphere. So making sure that they have all the cleaning products that are available to them and the ability to keep their equipment clean as it's moving in and out of the public space. That's really what that's about. So not a lot of physical building changes for some of these. And really the changes that we're going to talk about are pretty minor. So next slide, please. So ways that we can adapt the spaces with minimal construction, minimal adjustments and changes. So talking about the office environments, this is going to be the more admin areas, even aspects to public safety. I'll talk about the McKinstry standard and what our corporate approach has been. Very much reoccupying at 40%. That's a specific number. It gives us a goal to say this is going to be the overall capacity, the new revised capacity of our office spaces. We want to then continue to support remote work or virtual work, making those available to staff. That 40% doesn't have to be fixed to a set number of people. The idea is we can more or less hotel in and out and identify who needs to be in the office on any particular day. So there's a little bit of staggering shifts or staggering assignments there also. That occupying a certain, the number within the space, if you will, needs to carry throughout all of the spaces. So conference rooms doesn't mean that we can put that entire 40% of people into one space. We have to make sure that the social distancing stays in place. So any of those types of policies, it's really about making sure that space is there between everybody. Closing common spaces, kitchen spaces. So this one tends to be a little counterintuitive in an office, right? We tend to think that this is where we want to gather. But there's a lot of areas that are just commonly touched. Everybody's going to the coffee pot. Everybody wants to contribute, get that candy bar from the snack box or something. But those are areas where it's just going to be a higher traffic area. So it's going to be a little bit more difficult to keep that clean consistently. So closing those areas off, encouraging employees to bring their own food and water bottles, so they're not necessarily going to the drinking fountains or water cleaning stations. In those public facing areas, it may be that you have to just post warnings. It may be that there's just not an opportunity to expect, or it's unreasonable to expect that everyone's going to be bringing their own water. So in that case, putting appropriate signage in place and including those devices, water coolers, in a regular cleaning regimen. So that kind of shifts into the public space aspect, and now making sure that the markings and movement of people are all moving in the same direction. So this is where you would start adding floor markings. These can be temporary. They could be taped to the floor. Certainly, we've all seen the stickers that are out there. Installing sneeze guards. I mean, these are just the plexiglass partitions that we see commonly grocery stores now. installing those in places where maybe it had just been a tabletop interaction, right? A customer counter, that sort of environment, and having appropriate signage as to why these things are present, recognizing which way it is that people go, having clearly marked entrances and exits, designating these so that everyone's moving in one direction. Talk about a reservation system. So now when it comes down to delivering the services, it may be at a rec center. I know there are even some businesses that take this approach and basically making everything appointment based. So time at a rec center, perhaps taking a reservation for 90 minutes, something like that. Same thing, maybe having 15-minute appointment windows for transactional items within the city. Having that system sets up an expectation of somebody will be here at this particular time, and then it gives you the opportunity to schedule in time to deep clean those areas periodically. So every hour or so, every hour and a half, roughly 90 minutes, let's say, take the time to wipe down the surfaces with a disinfecting solution. Also limiting occupancy in the high traffic areas. Highlighting that if you recognize there's an area in your particular buildings that people tend to congregate, or if there's a lobby area where people would tend to group together, or a common waiting area, making sure that those areas are adjusted, and let's start making some changes there. Signage certainly to keep people from congregating in those areas, letting them know what the expectation is, and in some cases making physical changes, which we'll go to the next slide. So now when you're talking about some of those areas, making modifications, this is removing seats in waiting rooms or other areas. Could be maybe blocking them off. Sometimes there may be permanent benches. So just putting some cones up, putting some tapes, it's very much like what we saw at the park, being able to physically enforce some of those gaps and barriers. Moving furniture and workstations around. So as we've talked about, having on a temporary basis, right, we're limiting our occupancy to 40%, aligning the furniture that we have in those places and the workstations that we have available with that sense of occupation and how many people are going to be there. Certainly keeping these things dedicated to say that each person has their own workstation and they're not necessarily going to be shared or be common to the extent that that's practical. That's definitely where we would want to go. That said, there's just going to be areas where people are going to be coming and going. So increasing cleaning in those areas, wiping down the common surfaces, and making sure that these cleaning supplies are all available. We mentioned communication. So this is something that, posting the signs doesn't require any major construction project. It's really just conveying what it is that you're doing and why you're doing it. Everything that we're talking about, again, is about instilling confidence. And so we want the employees and the public, as they're walking through the spaces, to know and acknowledge and understand that appropriate steps have been taken to keep them safe and to keep the environment as clean as possible. Relative to some other behavioral items, making sure that there's daily check-ins. So giving the employees or citizens the opportunity to basically self-report and say, here's a checklist for me to verify, am I feeling well? If I'm exhibiting any of these types of symptoms, it isn't that there's some negative aspect to it. It's simply self-recognition, and to say, okay, I'm going to change my behavior, and the behaviors that we've been talking about, it's very much about protecting our coworkers and other citizens in our communities. So we're going to intentionally recognize this is something that could impact them. So I'm going to take myself and maybe not go into work today, or maybe not go into that office, or I'm going to trade out a shift. But having that opportunity to just report and say, yes, in fact, I am feeling well. And it's important to you as city managers and operators, that your staff know that you care about them and their health. For some of those areas where you have continuous operation, setting up temperature checkpoints. This is something that just having a physical stop, and you walk in, and if someone's going to be there for a while, you're going to be in those public safety areas where less than 6 feet is going to be the norm. Just taking those temperatures as people are walking in to screen. And then when you have the opportunity to install hand sanitizer stations, to go ahead and post those. I know those can be a bit of a rare commodity these days, but making them available also on demand to folks will help reinforce that behavior of just keeping the area as clean as possible. So I'm not sure. I think at this point I was going to kick it back over to Ashley, but I'm not sure where the slides went.
Oh, can you, is it not?
Can we restart?
Just time check, Ashley. We got it's 10:40, so if you can wrap up in like 10 minutes, then we have about 10 more minutes for discussion.
Yeah, and Jim, we actually did get that question while I'm getting the PowerPoint. Courtney, Heather, I don't know if I can share, I have the ability to share my screen
you
again.
can ask that now as we're waiting to get that back up.
Yeah, Jim, the question is, do you ever list HVAC in the number of air exchanges per hour?
Yeah, absolutely. That's a common way to do it. It's not framed that way from ASHRAE. So I mean, it's hard to say whether that number is 1 air change per hour or 3. It's certainly not 6. You know, I mean, I would say if you're in that like 1 air change, you're basically lowering the statistical probability of transferring anything through that. I mean, right? It's like wastewater treatment. You're trying to dilute the inside air. You're trying to dilute it to a fraction where it's impossible to do that. So, you know, like 1 to 2 air changes per hour. Yeah, you're more than good. But typically, it's framed in terms of, they do it in terms of CFM per person. So it's really hard to say what it is in terms of air changes per hour, obviously, because it's just you know, ceiling height would be a major factor then in how many air changes you're getting per person. But typically in like a lab building, that's how they do that. But we're not into those kind of spaces. But yeah, you know, if you had to guess, it would be in that 1 to 2 air changes per hour range. If you put a gun to my head and made me say something. But if there are any other engineers on the call, they'd kill me for saying that. So, all right, take it back over to Ashley.
And you can see the presentation.
Yes.
So yeah, we're going to try to wrap it up in the next couple of minutes, but as we do, think of any questions that you have and feel free to type those in like you have been doing, and we can get to those questions at the end or during this as well. So I think just really quickly, high level, wanted to recover what we're doing to what you can do to be ensuring office space best practices. So you all know these and you've probably already been implementing them, but making sure that your employees wear face coverings in public areas and shared common spaces, and just overall following state and local guidance around that. Promoting hand washing, I think like Devin said, even putting hand sanitizer stations. We've seen some office spaces that have given employees their own hand sanitizer and cleaning supplies, and just making sure that they're wiping down their desk spaces at night. And if they do use a common area, that they're wiping down those spaces after they've used the common area. Physical distancing, it's an obvious one. Signage, we've covered that, but you know, even in offices, having one direction to go and putting signage around and just communicating how to go in, how to go out, and creating maybe a roadmap. I've seen some office spaces where they have, like Devin said, the specific entrances and exits, and then communicating that plan to your employees prior to getting them back into the municipal facilities. And cleaning your workstation and just maximizing safety. So one thing, you know, we covered a lot of content today, and we've developed a checklist to pass along to your facility staff. If you'd like that, let us know. We can also pass it along to Courtney and Heather to forward to everyone who was on the webinar, but just a high level covers some things that your facility staff can and should be doing before you reoccupy facilities or while you're reoccupying facilities. So around indoor air quality, building controls, occupant engagement's a big one that we've touched on. So just making sure you have the educational signage up, any markings that you need to put, whether it's floor markings or just signage around sanitizing and cleanliness, plumbing. And so just let us know if you want this checklist. We're happy to pass it along. A lot of our facilities team has worked to get this together, and it's a lot of just best practices across the industry that your facilities team can be doing.
Yeah, and I would just add to that, Ashley, you know, that's nothing private. So like she said, feel free to give it out. If you have a mechanical contractor, feel free to pass it along to them, and hopefully they can start checking some of those boxes, or, you know, have them ask questions.
Right. No, that's a great question. If you are contracting out some of this work and you want to make sure that your contractors that you're working with are doing all of this, this is a good checklist to pass along to them and just have them check off what they are and aren't doing. And that's a good way to utilize this checklist as well. See what you're doing in terms of outsourcing those services, and then what your team internally can be doing to fill in those gaps. And then last point, I think just, you know, Devin and Jim both touched on this, but just developing a communication plan. If you are implementing a lot of these around your HVAC system or within your facility, just make sure you're communicating to your residents and constituents and your employees about what you're doing to keep them healthy and safe. I think everyone wants to know. You'll definitely have some engaged citizens who I'm sure will ask you about that as well. So making sure you're communicating what you are doing, especially in your public spaces, to keep everyone healthy and safe. I think, you know, commitment of staff to help you out with this as well. So this goes back to the behavior engagement piece, but maybe making it a game, or just getting your staff to commit a little bit more to some duties outside of their normal day job, and just getting them to commit to helping keep these spaces healthy and clean. CDC actually has a lot of good signage that you can repurpose and utilize, so you don't have to reinvent the wheel. But I think just reaching out to fellow local governments, I'm sure CML has resources. We have resources that you can leverage. You don't have to reinvent the wheel on a lot of this communication and signage, but just leveraging what's already out there and putting it around your facility and making sure that you're increasing visibility. So you have the signage, but you want to put it in your weekly newsletters, which I'm sure you're all doing. If you have virtual council meetings, bring it up there to the public, emails, website, communicating more is better than communicating less. So that's always our philosophy, is you can't over communicate. Someone will still miss some signage somewhere. And then just getting continuous feedback. So I mentioned the survey at the beginning of the presentation, surveying your employees about what they want to see, but you can also survey your residents. I'm sure, again, a lot of you are probably doing this, but survey your residents on what type of communication and information that they want to see, and orient your communication plan around that. So really, I think that was about it for today. I don't know if we have a whole page, and we'll send out this webinar. We have a whole page, like Jim and Devin said, you know, resources that you can point anyone to that has questions. So we have a lot of these linked at the end of our presentation. I think we'll send this out so that you can look through these resources, send them to anyone that has questions around, you know, best practices or what everyone else is doing. So with that, we can open it up to questions. Courtney and Heather, I don't know if we had any more questions. But feel free to ask, and you know, we have our contact information we can distribute as well if anyone has additional questions that they would like to have addressed one-on-one after the presentation or in the future as well.
Great, thank you so much. I actually don't have any questions on my side. Heather, is there anything that you'd like to say?
Sure. If there's no more questions, I just want to give a big thank you to Ashley, Jim, and Devin from McKinstry for their expertise and advice today. I do have that checklist that Ashley was talking about from McKinstry, and I'll email that out to the participants with those resources you mentioned after the webinar, if that works for you guys. And just as a reminder, this webinar is being recorded and will be posted on the CML website at www.cml.org/COVID-19. So thank you so much again today. Thank you again to our panelists today.
Yeah, and thank you, Courtney and Heather, for getting this set up too into the Colorado Municipal League. Your team's a great resource, and we really appreciate the partnership and getting this information out there.
Yep, thanks for having us.
Thank you so much.
All right, everyone, thank you so much again to our panelists. Thank you, attendees, for joining us today. Just to mimic what Heather said, these materials will be available on our website at www.cml.org/COVID-19. We hope to have them up by the end of the week, so please keep an eye on that. And that will conclude our webinar for everyone. So thank you again for joining us, and have a great day.